What is a coagulation test in veterinary medicine? Have you ever wondered how veterinarians determine if a pet's blood can clot properly? This is where a coagulation test comes into play. A coagulation test is a diagnostic blood test that evaluates an animal's ability to form clots. This is essential for stopping bleeding after injuries. The test measures the function of various proteins known as coagulation factors, which are mainly produced by the liver. These factors work together in a specific order to form a stable blood clot. The process of coagulation is quite fascinating. It involves blood vessel lining cells, known as endothelial cells, platelets, and circulating coagulation factors. When there is an injury, these components activate in a specific sequence through two main pathways, the intrinsic and extrinsic pathways. Both pathways converge into a common pathway that leads to clot formation. Veterinarians perform coagulation tests for several reasons. They may screen animals at risk for clotting disorders, especially certain breeds that are prone to deficiencies in coagulation factors. These tests are also helpful in diagnosing unexplained bleeding episodes. Before surgeries or invasive procedures, veterinarians assess coagulation status to prevent bleeding complications. Additionally, monitoring diseases that affect the liver is crucial, since the liver synthesizes most coagulation factors. Common coagulation tests include prothrombin time and activated partial thromboplastin time. Prothrombin time measures the activity of coagulation factors in the extrinsic and common pathways. It does this by timing how long it takes for a fibrin clot to form after adding calcium and activating agents to a blood sample. Activated partial thromboplastin time evaluates the intrinsic and common pathways in a similar manner. These tests are typically performed on fresh or citrated whole blood samples. Blood can be collected through direct venipuncture or jugular vein catheters in dogs, and the results are usually consistent regardless of the method used. Advanced testing methods, such as microfluidic assays, can assess platelet function and clot formation under conditions that simulate blood flow. However, these are less common in routine veterinary practice. In the field of clinical pathology, coagulation tests are vital for identifying bleeding disorders, monitoring anticoagulant therapy, and evaluating changes in coagulation due to systemic diseases like liver disease. Since the liver plays a key role in producing coagulation factors and regulating clot breakdown, any liver dysfunction can affect test results. Therefore, careful interpretation is necessary. To sum it up, coagulation tests are essential tools in veterinary clinical pathology. They help veterinarians assess and manage clotting function, guide treatment decisions, and ensure the safety of pets during medical and surgical interventions.